Well, welcome to this talk on the male reproductive system, the anatomy and physiology that is necessary to produce the next generation. Well, let's start this topic off by thinking about the scrotum. Now, scrotum is a term which simply means a bag. And this container is composed of loose skin, fibrous and connective tissue, with some subcutaneous smooth muscle. And although the scrotum looks like one pouch from the outside, internally it is divided into two sacs by the scrotal septum, a septum being any structure which divides. And this dividing septum is composed of connective tissue and also contains some smooth muscle fibres. Each scrotal sac contains one testis, one epididymis, and the testicular end of the spermatic cord. Now, optimum sperm production in the testes requires a temperature 3 degrees centigrade below normal body temperature. And this explains why the testes are located in the scrotum, external to the pelvic cavity. It keeps them cool, because spermatogenesis works best in cooler conditions. Now, in cold conditions, the subcutaneous and septal smooth muscle contracts to draw the testes close to the warm body. Conversely, in warm environments, these muscles relax and the testes descend further away from the warm body cavities. And this explains why testicular examination is easiest performed in warm conditions or after a warm bath when the testes are well descended. Now, the testes contain a lot of very fine tubes called tubules. In reality, each testis contains 200 to 300 lobules, each of which contain 1 to 3 semifiniferous sperm-forming tubules. Semifiniferous tubules drain newly formed sperm through the short, straight tubules into the rete testis. From the rete testis, there are 12 to 20 efferent ducts through which sperm may pass to reach the epididymis. And the epididymis itself is essentially a single long tube. And again, the level of tight packing is impressive. If the ductus epididymis were uncoiled, it would be a whole 6 meters long. Now, the testes are the male gonads, sometimes also called testicles. They are paired glands located in the scrotum. And as the testes are the male gonads, they are equivalent to the ovaries in females. In fetal life, the testes actually develop in the abdomen near the kidneys, but they usually descend into the scrotum before birth at about 7.5 months gestation. And a typical testes is about 5 centimetres long by about 2.5 centimetres wide, and it might weigh 10 to 15 grams each. Now, each testis contains a surrounding capsule of dense white fibrous tissue, and that's called the tunica albigena. And this fibrous structure folds inwards to form numerous septa, which divide each testis into 200 to 300 lobules. So they're really quite complicated structures, each testis. And within each lobule, there are 1 to 3, occasionally more, but normally 1 to 3 tightly coiled tubules, forming closed loops, which open at the top to allow the sperm to exit. And these are the semifiniferous tubules, of which there are a total of 400 to 600 per testis. And each individual semifiniferous tubule would be 70 to 80 centimetres in length if straightened out. And these semifiniferous tubules are the site of sperm production, the process correctly termed spermatogenesis. Between the semifiniferous tubules, within the lobules, there are groups of interstitial cells called the Leydig cells, the interstitial cells of Leydig. And these are the cells which produce and secrete the male hormone, collectively referred to as androgens, the main one, of course, being testosterone. So basically, a testis is a unit for producing sperm and for producing testosterone. Let's think more about the sperm and seminal fluid ducts. And we notice on the diagram that they're straight tubules connecting the semifiniferous tubules to the rete testis. So the semifiniferous tubules produce spermatozoa, and they also produce some fluid which acts as an internal or an initial internal transport medium for the young sperm. It gives them a medium in which to swim in and also provides them with nutrients and physiological solutions. And once formed, sperm cells pass out of the semifiniferous tubules and travel through a series of very short passages called the straight tubules. And these straight tubules connect with a network of ducts called the rete testis, which forms a collecting chamber for the sperm. And from the rete testis, there are 10 to 20 connecting tubules. That is the efferent ductiles, through which the sperm travels to reach the epididymis. So from this diagram we can see that the sperm and the initial medium in which they're transported in is produced in the semifiniferous tubules, going through the straight tubule into the rete testis before passing into the epididymis. And we notice that the epididymis is external to the testis, and an epididymis is behind the testis in the scrotal sac. Now, the connecting efferent ductiles from the rete testis enter the head of the epididymis, as we see on this diagram. And these efferent ductiles are highly coiled within the head of the epididymis, and all join to form one single tubule called the ductus epididymis. This is a single, highly coiled tubule which thickens towards the end as it passes through the body of the epididymis down towards the tail of the epididymis. The ductus epididymis is tightly coiled, and if you extended it, dissected it out of the epididymis, it would be 6 meters long if it was fully uncoiled. In the tail of the epididymis, the ductus epididymis becomes continuous with the ductus deferens. And this allows sperm to exit the ductus epididymis and to enter the ductus deferens. And the sperm mature within the tubules of the epididymis over a period of about 14 days. And if not ejaculated, sperm may be stored in the epididymis for up to several months. As the walls of the ductus epididymis contain smooth muscle fibres, they are able to contract during sexual arousal to propel sperm into the ductus deferens prior to ejaculation. And any sperm that are not ejaculated are eventually broken down in the ductus epididymis, and eventually the contents will be reabsorbed if the sperm are not ejaculated. Spermatogenesis is the process of sperm production, and this occurs in the semifiniferous tubules of the testes. And sperm are also referred to as spermatozoa. And sperm cells are produced from a population of stem cells called spermatogonia. And these cells are found on the basement membrane of the seminiferous tubules and have been present in the testes since the individual was an embryo. And these spermatogonia are therefore the germ cells. Germ cells are the cells which pass genetic information on from one generation to the next. As spermatogonia differentiate to produce sperm cells, they undergo meiosis, the form of cell division which reduces the number of chromosomes from 46 to 23 chromosomes per cell, going down from the diploid to the haploid number. All gametes, sperm and ovum, must contain 23 chromosomes, so that when fertilization of the newly formed zygote occurs, this zygote will contain 46 chromosomes. Meiosis also ensures that half of the formed sperm contain an X chromosome and half a Y chromosome. And this is vital to ensure that the next generation contains about the same number of girls as boys, because the sex of the child, of course, is determined by the sperm. If the sperm contains a Y chromosome, that will give rise to a boy. If the sperm contains an X chromosome, that will give rise to a girl. And if couples are trying to conceive, it's important for the man to have good nutrition and to avoid toxins such as cigarette smoke in order to produce good quality sperm. So, for example, if a man is smoking when he's producing the sperm, toxins such as mutagens from the smoke will go into his lungs, go into the blood, circulate systemically, circulate around the testes, and can potentially damage, even causing mutations in the sperm, giving rise potentially to disease in the next generation. So we very often talk about the importance of mum not smoking and not drinking and looking after herself, but it's equally important for dad to do exactly the same, to optimise the quality of the sperm that is going to produce the next generation. So the sperm, or spermatozoa, are the male gametes. And the number of sperm produced is huge. 300 million sperm can be produced a day by the testes. And located in the head of each sperm cell, the nucleus contains 23 chromosomes. And at the front of the spermatozoon is a structure called an acrosome. And this acrosome contains enzymes that the sperm will need to pass through the cervical mucus and to break down the outer covering of the ovum in order to deliver the 23 chromosomes into the ovum to fertilise with the 23 chromosomes from the maternal ovum. And the body of the sperm is packed with mitochondria, and these are needed to generate the energy required for locomotion of the sperm towards the ovum. Locomotion is enabled by contractile bundles of microscopic filaments running from the neck through the tail. And unlike women who stop producing viable gametes at the menopause, men can go on producing viable sperm into old age. Now, the spermatic cord, one per testes, suspend the testes in the scrotum and pass through the inguinal canal through the groin into the pelvic cavity. And the spermatic cords are covered by a sheath composed of fibrous and connective tissue with smooth muscle fibres. And within this sheath are located the ductus vas deferens, transferring sperm towards the urethra, There's also a testicular artery carrying oxygen-rich blood and nutrients to the testes and the epididymis. The spermatic cord also contains testicular veins, transporting deoxygenated blood back from the testes towards the larger veins in the pelvic cavity. These testicular veins will also transport testosterone formed by the interstitial cells of Leydig, or the Leydig cells of the testes, into the systemic circulation for distribution to all of the body tissues. Lymphatic vessels within the spermatic cord transport lymphatic drainage fluid from the testes and the epididymis again into the larger lymphatic vessels. And the spermatic cords also contain autonomic nerves to control peristalsis of the sperm ducts and to provide sensation of the testes. The ductus, or the vas deferens, it's the same thing really, the ductus deferens is also called the vas deferens, is the tubule which receives sperm from the ductus epididymis. After leaving the ductus epididymis, the ductus deferens, or the vas deferens, ascends in the scrotum within the spermatic cord before passing into the pelvis, into the pelvic cavity. From here, it loops over the side of and then behind the urinary bladder. So this is the vas deferens now, going through the pelvis. Towards the end, or terminal section, the ductus deferens widens into a section called the ampulla. Walls of the ductus deferens are muscular in order to generate peristaltic contractions during sexual arousal. And these peristaltic waves of contraction propel the sperm from the epididymis towards the ejaculatory ducts prior to the process of ejaculation. The ductus deferens ends where it merges with the duct from the seminal vesicle to form the ejaculatory duct. So the vas deferens ends when it merges with the duct from the seminal vesicles to form the ejaculatory duct. And like the epididymis, the ductus deferens can store viable sperm for several months. However, if ejaculations are frequent, sperm may be only stored in the ductus deferens or only be in the ductus deferens for a few days. Now there are two ejaculatory ducts, one on each side, and they're formed by the joining of the ductus deferens and the duct from the seminal vesicle. And these ejaculatory ducts pass through the prostate gland and terminate as they open into the prostatic urethra. So the prostatic urethra is that component or that length of the urethra that is actually passing through the prostate gland. And just before ejaculation occurs, the ejaculatory ducts eject sperm and the seminal vesicles eject secretions into the prostatic urethra. So the seminal fluid is made up of secretions from the seminal vesicles, the sperm with some fluid medium from the vas deferens, and also there is more ejaculatory fluid generated by the prostate gland itself. Now the bulbourethral glands, sometimes called Cowper's glands, these are two small glands located on either side of the membranous urethra, and they have ducts which open into the spongy urethra. During sexual arousal they secrete mucus which lubricates the urethra to facilitate the smooth passage of sperm and seminal fluid. And these secretions will also lubricate the end of the penis to some extent. And as bulbourethral secretions are alkaline, the sperm are also protected from any residual acids in the urethra which might be present from the passage of urine in the recent past. So the semen or seminal fluid is a thick, cloudy, sticky fluid composed of a mixture of sperm with the other seminal secretions that we've talked about. And seminal fluid is a mixture of the secretions from the seminal vesicles, the prostate gland, and the bulbourethral glands. And there's also some fluid secretions from the seminiferous tubules themselves. Collectively, seminal fluid provides sperm with nutrients, a transport medium, and a protection from the acid vaginal environment. In a typical ejaculation, there will be 2.5 to 5 mils of seminal fluid, containing in the order of 100 million sperm per milliliter of seminal fluid. Now, of course, it's good to reproduce when we want to reproduce, but it's also good to avoid reproduction on occasions. And a highly effective means of male sterilisation is vasectomy, where small sections of the ductus, that is the vas deferens, is removed from the spermatic cord before it enters the pelvic cavity. So that's why it's called vasectomy, removal of part of the vas. The ends of the vas deferens are then closed to prevent any more sperm passing from the testes into the urethra. And if this is done on both sides, no sperm can travel from the testes to the ejaculatory ducts, meaning that the ejaculated fluid will contain no sperm at all. After vasectomy, men need to be told that they will have a substantial reserve of sperm in the length of the vas deferens, so may remain fertile for some time after the procedure. It can be quite some time and should not be declared sterile until samples of their semen have been analysed and found to contain no spermatozoa at all. But after that period of time, this is a completely effective method of male sterilisation and therefore family planning and population control. Now, the seminal vesicles, or the seminal glands as they're sometimes called, these are two glandular structures. They're about 5 centimetres long and they lie behind the base of the bladder. And they're blind-ended pouches which are internally lined with secretory epithelial cells which produce the fluid. And this fluid eventually forms 60% of the volume of the semen, which is ejaculated during sexual intercourse. Fluid from the seminal vesicles is alkaline, which helps to neutralise the acidic environment of the vagina. Without this effect, the acidic vaginal environment would inactivate and kill most of the sperm. Fluid from the seminal vesicles also contains the monosaccharide sugar fructose, and this is used by the mitochondria in the sperm to produce the energy required for sperm motility, to beat their tails, to move the sperm along towards the ovum. Prostaglandins in the fluid stimulate sperm motility and may stimulate muscular contraction in the female reproductive tract. And this female muscular contraction probably aids the passage of sperm from the vagina towards the ovum high in the uterine tube. Seminal vesicle fluid also contains clotting factor protein, and these clotting proteins help semen to coagulate in the vagina after ejaculation. Once the semen has coagulated, it's less likely to simply run out of the vagina, thereby increasing the number of sperm which is retained. And sperm can remain viable after ejaculation in the female genital tract for about 5 days. Now, the prostate gland secretes a milky fluid which contributes about 25% of the total volume of the semen or the seminal fluid. Components in prostatic fluid contribute to sperm viability and motility, and also have antibacterial effects to kill bacteria. Individual glandular units within the prostate gland open independently into the prostatic urethra via several prostatic ducts. Immediately prior to ejaculation, fluid from the prostate gland mixes with fluid from the seminal vesicles and sperm from the testes. Now, the size of the prostate gland increases slowly from birth to puberty. Then it grows rapidly in size up to the age of about 30. In some men, it starts to increase in size again after the age of about 45 years. And sometimes the enlargement is so great that the gland compresses the prostatic urethra running through it. And this will lead to difficulty passing urine and lower urinary tract urinary symptoms, what's called LUTS, lower urinary tract symptoms. The disorder is benign, and it's called benign prostatic hyperplasia. But having said that, cancer of the prostate is also possible, and it's actually the single most common cancer diagnosed in men in the UK. And the longer men live, the more likely they are to develop prostate cancer. Now, in men, the urethra is about 20 centimetres long. And this length makes it difficult for bacteria to pass from the outside environment up the urethra to the bladder, and is one reason why cystitis is less common in men than in women. And the urethra is divided into 4 sections. Firstly, the short pre-prostatic part is surrounded by a cuff of smooth muscle which acts as a sphincter. Secondly, the prostatic urethra is the section of urethra which passes through the prostate gland. Thirdly, the membranous urethra is a short, narrow section connecting the prostatic urethra with the spongy penile urethra. Fourthly, the spongy urethra extends from the bulb of the penis to the external urethral orifice at the end of the penis. And this 4th section is described as spongy as it is surrounded by the erectile tissues of the penis. Now, flow of fluids through the urethra is regulated by 2 sphincters. Firstly, the internal sphincter is a cuff of smooth muscle fibres, so is under autonomic control. Because it's smooth muscle, it's autonomic. And the internal sphincter contracts to retain urine within the bladder and relaxes to allow urination. Also, during ejaculation, this internal sphincter will contract to prevent retrograde movement of the seminal fluid into the bladder. There's not a lot of point ejaculating backwards into the bladder. At the end of the prostatic urethra, there's a second sphincter, and this is composed of skeletal muscle, allowing for a degree of voluntary control. And this sphincter will relax to allow a flow of urine or the passage of seminal fluid from the prostatic urethra. In addition to the mucus secreted into the urethra by the 2 bulbourethral glands during sexual arousal, the urethra is routinely lubricated and protected by mucus secreted from numerous minute urethral glands. And these small glands drain directly into the spongy urethra. So there is a layer of mucus protecting the internal surfaces of the urethra. Let's think now about the penis. This structure has three components: a root, a body, and the glans penis on the end. The body of the penis is composed of three cylindrical areas of tissue, each being supported by an individual sheath of fibrous tissue. Either side of the penis there is the cylindrical mass of tissue called the corpus cavernosa. Between these two structures is a third smaller cylinder of tissue called the corpus sponginosum. And the urethra runs through the corpus sponginosum. And the whole body of the penis is surrounded by layers of fascia and skin. The root of the penis is the internal component situated within the perineum. At the end of the penis, the corpus sponginosum enlarges to form the glans penis. At the tip of the glans penis is the external urethral orifice. Covering the glans penis is a retractable, loosely fitting area of skin called the foreskin. Sometimes, if the foreskin is too tight or there's repeated infections developing underneath it, it may sometimes be surgically removed in the process of circumcision. And it's also removed in young children in some religious groupings. Now, within the corpora cavernosa and the corpus spinosum, there are numerous blood sinuses, which are small spaces that can fill with blood. And these small vascular spaces are surrounded by smooth muscle and elastic tissue. Collectively, the corpora cavernosa and the corpus sponginosum comprise the erectile tissue of the penis. Surrounding the body of the penis and the individual compartments of erectile tissue are layers of fibrous connective tissue. Now, during sexual arousal, stimulation of the parasympathetic nervous system leads to sinuses within the erectile tissue filling up with blood, increasing the size and stiffness of the penis. This increase in the volume of blood retained within the penis is facilitated by dilation of arterial vessels with constriction of venous drainage. And these erectile changes are necessary to cause the penis to become stiff and erect, which is necessary for penetration of the vagina. Impotence describes the inability to achieve an erection, and this may occur for various medical and psychological reasons. Ejaculation describes the powerful ejection of semen from the external urethral orifice. Prior to ejaculation, there are peristaltic contractions in the epididymis, the ductus vas deferens, seminal vesicles, ejaculatory ducts, and the prostate gland to propel seminal fluid or semen into the prostatic urethra. Peristaltic activity in these structures is initiated and regulated by activity of the sympathetic nervous system. So the process of erection is parasympathetic, but the process of ejaculation is sympathetic. The process whereby sperm and seminal fluids are ejected into the lumen of the urethra is termed emission. Once in the urethra, the sperm and seminal fluid mix to form the semen. Next, there are further rhythmic contractions in the genital ducts and urethra, coordinated with contraction of muscles around the base of the erectile tissues. These muscle contractions compress the erectile tissues, contributing to the pressure increase within the urethra, which propel the semen out of the urethra. Emission and ejaculation are associated with the sensory experience described as orgasm and may occur during sexual activity, masturbation, or it can also occur nocturnally during sleep. The interstitial cells of Leydig in the testes secrete several androgens, but by far the most abundant one is testosterone. At puberty, testosterone and sperm production are stimulated under the influence of anterior pituitary gonadotrophic hormones, particularly luteinizing hormone, LH, and follicular stimulating hormone, FSH. In men, the follicular stimulating hormone, working together with testosterone, stimulates spermatogenesis, and luteinizing hormone stimulates testosterone secretion. And despite these different functions in men, these two hormones retain the same names as they do in women. So the function of these hormones was first discovered in women, but the same hormones are having these effects in men, albeit slightly different effects. And after puberty, testosterone levels remain high up until a man is in his 50s, maybe at about 50, then they start to gradually reduce with age. In fetal life, if there's a Y chromosome present, the Y chromosome causes the initial genital tissues to produce testosterone. If this stimulation from the Y chromosome does not occur, a baby girl will develop. And it is this fetal testosterone which causes the development of the penis, prostate gland, seminal vesicles, male genital ducts and scrotum, as well as other male body characteristics. And testosterone also causes the testes to descend into the scrotum in late fetal life, around about 7.5 months gestation. From shortly after birth and throughout boyhood, the levels of testosterone in the blood are very low. But with puberty, testosterone stimulates the enlargement of the primary male sexual characteristics, which are the penis, testes and scrotum. And the same testosterone also stimulates the development of male secondary sexual characteristics, such as distribution of body hair, thickening of the vocal cords, which causes deepening of the voice, the development of skeletal muscles, and other characteristics which distinguish men from women. So, male secondary sexual characteristics. Its testosterone causes the growth of the male distribution of pubic hair. It also causes facial hair and the usual growth of chest hair. Hair growth on other surfaces such as the arms and legs is also stimulated. As we mentioned, enlargement of the larynx, together with thickening of the vocal cords, causes the tone of the voice to deepen, resulting in the voice breaking with puberty. Testosterone increases the thickness of the skin over the entire body surface. Production of sebum by the sebaceous glands is also stimulated. And the combination of skin thickening and increased sebum production can lead to acne around the time of puberty. Testosterone stimulates protein formation and muscle development, and as a result, most men have about 50% greater muscle mass than women. In conjunction with muscle development, there's also an increase in bone mass, with stimulated synthesis of bone collagen and additional deposition of calcium. Both of these factors lead to bone growth and thickening. Testosterone probably also increases red cell concentration, fluid and electrolyte retention, and basal metabolic rate. So men have a higher hemoglobin level than women usually, and they often have a higher basal metabolic rate. Testosterone in combination with genetic factors is the cause of male pattern baldness. Testosterone stimulates the brain in both men and women to increase interest in sex, explaining the arousal of sexual interest at adolescence, as the testosterone has this stimulating effect on the brain. It's also interesting to note that men have significant amounts of estrogen in their blood, and most of this is formed by converting testosterone into estrogen in the liver.